Or closing the development gap for children from lower income families in Singapore. A study shows that those enrolled in the early childhood intervention program known as Circle of Care are performing as well as students from other income households. The findings from an independent evaluation of the project, now in its 10th year, a sign that the preschool care model is working well. Or it shows that children from the program entering primary 1 fared as well, if not better, in skills associated with words and numbers versus an international benchmark. Or compared with a study on trends in international mathematics and science, children in the Circle of Care program did better at counting, recognizing and writing numbers up to 20. Their ability to read and write also matched up. Speaking at the Early Childhood Development Conference, Senior Parliamentary Secretary for Social and Family Development, Eric Chua, stressed the importance of strengthening social mobility from childhood.
The early years of a child's life are critical for their development. Unfortunately, in many disadvantaged families, children may not have a conducive environment for their development in later years. The gaps in development between them and their peers can widen over the years unless something is done way upstream to give them a better start.
The study by Research for Impact surveyed 146 parents in the program. It's run by non-profit group Care Corner Singapore, who spoke with parents about how the COC program has benefited them as well as their children. Amongst them is Madam Shah, whose daughter Anissa received help in areas like speech and occupational therapy.
Anissa, she's 8 years old this year in primary 1. Due to her speech delay and developmental delay, she has to continue another year in K2. COC has helped us a lot in terms of the help that I need for Anissa, the support that we need. I think I won't be able to do this alone.
In looking at how children in the Circle of Care program fared, the study assessed how their parents felt about progress in 4 areas of development. Now, in terms of general academic skills, 87% of respondents saw improvement following care under the program. And when it came to life skills, 89% agree that it helps their children learn to be more independent and adaptable to unexpected changes. And some 88% also notice their children having a healthier social circle. They also forge closer friendships and are more ready to lend a helping hand. 87% of parents also note that their children are more able to express feelings, cope with emotions, and seek help when they need it.
And to share more on the study results and the on-the-ground experience, we're joined by Joanne Yoong. She's founder and CEO of Research for Impact. She's also adjunct professor at NUS Yong School of Medicine.
And also joining us this evening is Cherlynn Ang. She is Program Manager of Circle of Care by Care Corner Singapore. Ladies, welcome to the studios. It's good to see you this evening.
Thank you for having us here.
Cherlynn, let's start with you. The program wants to create this environment of care, which is centered around children from underprivileged families. You must have your priority areas. Share with us what they are.
I think it's exactly what our name represents, building a circle of care around our children. So many of our children from low-income families, they do not have the resource or perhaps even the circle of support that they require for the children to do well. And so one of our aim of the program is to really bring about that circle of support around the child by developing an ecosystem of integrated care provided by health professionals from healthcare, social services and the education sector. So of course we do have key focus for our program. Firstly, beyond just academic readiness, we do want to promote life skills in our children. So we do this through the parents in family coaching as well as through our preschools. Secondly, some of the families that we work with are actually struggling to meet the basic needs of the family. So we work with the family in supporting them in this area while equipping them with parenting skills. Lastly, most of the families that we work with, they may not be able to pick up health and development challenges that their children may be experiencing. Hence, we partner with NUHS to bring in screening in the preschools for early identification and intervention. And at the heart of it, it's really to promote preventive care that goes as upstream as possible in order for us to move the needle for social mobility.
All right, Ms. Yoong, a great deal there promised from Cherlynn. But now, your study, and I'm going to ask you to qualify one of those. So all these recommendations, the progress made, the improvements, you need a benchmark, or a way to measure this. So as an example, and I pick just one of them, developmental programs like Circle of Care, they can yield a 7-fold return of investment in what's called a child's societal value. Now, Dawn and I were just covering various points, both in COC as well as your research.
Sure.
So 4 areas, social skills, emotional skills, academic, just 1 of 4. Now, all these different ways in which to measure whether or not a child is doing well. How do you even measure in an accurate way a child's societal value?
Right. So I think what we want to do is sort of first step back and say what we're trying to do is put a price on something which is essentially is priceless. And whenever we do something like the social return on investment analyses, we're trying to put a value on something which is intangible. So inherently what we do is something that captures that value in a way that perhaps is not precise, but gives us a sense of what that magnitude is and is reflective of proxy values, or things that we think of as reflecting adequately what that resource means to society. So I'll give you a little bit of an example. When we talk about early childhood programs bringing back 7 or even 10 times return. This is not unique to the Circle of Care setting, actually. What we had done is a review of research of cost-benefit analyses of similar programs which have been in existence for 40 over years. And what they do is that they compare the costs of this program, which are very easy to measure, to the effects that appear upstream later on in a child's life. So we're looking at savings from special education programs off the bat. We're looking at higher earnings when children graduate from school and get better jobs.
It's very long-term then.
They are very long-term, but we're also looking at medium-term effects. We're looking at savings from lower crime rates. We're looking at savings from less risky behavior as teenagers. We're looking at better health and healthcare in the long term. And speaking of the very long term, when we're looking at some of the programs that have been in place for decades, what we're seeing are intergenerational effects, because we're seeing that the children of these children are also doing better because they're growing up in more stable households and less likely at the end of the day themselves to be underprivileged.
Cherlynn, as Ms. Yoong was saying just now, the Circle of Care is really, what I hear you describe is something which is priceless. It's very difficult to calculate the benefits over the long term, but the children need support now, and to build on that support as well. To be able to build on that, you need to have certain benchmarks. You definitely need to have the parents as well involved in that process. It may be a very complex process. It may be complex for them to understand as well. They need that support too. Is it difficult at all to get the buy-in of parents? Do you face challenges?
Actually, you're right to say, Dawn, that in order for us to move the needle for the children, the parents are very key stakeholders. But thankfully for us, in our experience, most of the families that we have engaged with, the parents have been very open to allow us to come alongside them, to journey with them in their parenting journey. And I think that really comes down to our fundamental beliefs that most parents want to do well by their children. And when given that opportunity to grow alongside us, most of them actually have agreed to join us. And I think the other thing that really helped us was our partnership with preschools. They were the bridge for us, and they allowed us to be able to establish the trust with parents when we first entered into the system with them. But of course, we experience a group of families that are highly stressed by the daily stresses of life, such as housing, employment, health, mental health issues. And oftentimes for this group of families, while they are open for us to work with them, what we found helpful was to bring in additional support by linking them up to the Family Service Centre and social service officers. So it's kind of expanding their circle of support as well in order to stabilize their family circumstances before we can come in to work with them on equipping of parenting skills.
There is that transitional support.
Yes.
Janice, Ms. Yoong, that Cherlynn is referencing there. Why is it so important? I mean, how is it actually sort of tackled?
Well, it's so important because, again, in our review of the research and in our experience with Care Corner, what studies tell us and parents tell us is that that stability and support around periods in which households that are already vulnerable can be thrown off course is really key. What does that look like? It can look like a number of different things. It can look like a care team that's supportive. It can look like parental education to give people those core skills. It can look like a holistic development profile that travels with the child from school to school. And it can look like a social worker who provides a listening ear. And in Circle of Care, it looks like all of these things. What's really important is that that transitional support is actually tailored to the needs of each family to make sure that they get what they need for the circumstances that they have.
It's a long and challenging but very fruitful journey. Thank you, ladies, so much for coming into the studios to share more on this important work that you're both doing. That was Joanne Yoong there from Research for Impact and NUS Yong Lulin School of Medicine, and Cherlynn Ang from Circle of Care by Care Corner Singapore. Thank you very much.
Thanks for coming this evening.